So the update is that we've had 20,324 positive test results returned, including 6,704 rapid antigen tests and 13,620 positive PCR tests. The 13,620 positive PCR results were returned from 76,672 PCR tests. We've got 2,712 people in hospital, including 189 people in ICU, of whom 72 are ventilated. We are announcing the deaths of 34 individuals today, 26 men and 8 women, and can I express my condolences to their families for their loss. Of the 34 people who died, 1 person was aged in their 40s, 5 people were aged in their 50s, 5 people were aged in their 60s, 9 people were aged in their 70s, 10 people were aged in their 80s, and 4 people were aged in their 90s. 2 people had received 3 doses of the COVID-19 vaccine, 23 had received 2 doses, and 3 people had received 1 dose, and 6 people were not vaccinated. Of the 8 people who died aged under 65 years, 6 were men and 2 were women, and 4 of these people had received 2 doses of the vaccine, 1 person had received 1 dose, and 3 were not vaccinated, and 7 of these individuals had serious underlying health conditions. Again, emphasising the important role that boosters have in protecting individuals, particularly those that are at severe risk of severe outcomes, including those over 65 and those with underlying medical conditions. Can I echo the Premier's comments about the importance of schooling for children's health, well-being and development? And I share the Premier's support for children engaging in face-to-face learning. Whilst the community cases are high, we will expect to see that schools mirror what is occurring in the community. We will expect to see cases amongst children and staff attending schools. The twice-weekly testing regime that the Premier has spoken about will allow us to pick up those cases a little earlier through that rapid antigen testing. But in addition, we're calling upon all parents to ensure that any children with symptoms are not sent to school. So please do not send your child to school if they have symptoms. Instead, get them tested, and even if they've got a negative test on that first day, please keep them home and do a repeat test, and only send them back if there's an alternate diagnosis. So for instance, if they've got hay fever and you're clear that that's the cause. In terms of we are likely to see some transmission in schools, but the strategies that have been put in place by education in conjunction with health are strong. I will leave Minister Mitchell to discuss those strategies, but there's a range of protections that many parents will be familiar with. Some of the similarities to what were put in place in previous years, and those strategies aim to reduce and minimise the spread of COVID in our schools. However, we are expecting that with the return of schools and with a bit more mobility, that we might see an uptick in case numbers. But offsetting that, we're getting the booster doses into individuals. I do ask that parents in that first 4 weeks try and minimise their children's activities or connections with other children in sleepovers and other activities that might drive infection, so that we can preserve that face-to-face time at school whilst that community level of transmission is high. Also, and Professor McCartney will talk to this later, but certainly children with significant underlying health conditions, we ask you to talk to your doctor about the timing of your vaccinations and your plans for return to school. Thank you.